Welcome back to Primetime News, and a special welcome if you're watching online at onespotmedia.com. Up first this evening, fears of the coronavirus reaching our shores have been realized, with the country recording its first case. Details were revealed at a press briefing today. Now, according to the Ministry of Health, the victim is a Jamaican female who is also a resident of the United Kingdom. That country has over 300 coronavirus cases, and just today, the death toll has risen to 6. Shamela Pullen attended the briefing and filed this report.
Minutes after 12 Tuesday afternoon, the Ministry of Health called an emergency press conference in St. Andrew to announce that the country has a case of COVID-19.
Jamaica today confirmed its first imported case of coronavirus disease 2019, COVID-2019, here in Kingston. The patient is a Jamaican female who had traveled from the United Kingdom, which, as you know, has cases of COVID-19. She arrived in the island on March 4th, presented to the public health system on March 9th, and has been in isolation since then.
Dr. Tufton says based on the individual's history and the symptoms presented, a clinical sample was collected and sent to the National Influenza Center, where tests confirmed the presence of the virus.
The patient and family members have been informed of the development. The patient's infection was travel-related based on the assessment. However, steps are being taken to prevent the risk of community spread. These measures include the dispatch of a health team to the home of the patient for assessment and initiation of public health measures, the identification and contact tracing for all possible exposed persons.
But according to Dr. Tufton, the individual did not take the necessary precautionary measures upon arriving in the island, which is why he said it took at least 5 days before health professionals were made aware.
So the person would have been screened in the normal course of activities at the port of entry. But having arrived, one of the things that we tell persons who come in is that they must also self-assess, and they are given documentation to that effect. And I think the person did not, based on what the investigation suggests, have symptoms until later, days after arriving. And having had those symptoms, they went to see their doctor.
The female is said to be young and is from the Bull Bay area, which borders St. Thomas and St. Andrew, and came to the island for a funeral late last week. She's currently being held in isolation at the University Hospital of the West Indies, UWI. Medical Chief of Staff at the UWI, Dr. Carl Bruce, says the individual is not a risk to the public because at present the hospital has 3 negative pressure facilities to house cases like this, which protect staff and other persons who come to the hospital for treatment from exposure to COVID-19.
So we are currently using one of our isolation rooms, and that was that started from yesterday, but the patient is not in contact with the rest of our patient population, and the team that's managing the patient has been trained as such.
Shamela Pullen, TVJ News.